माय मोगाचो येवकार सगळे आमचे CCR TV पळयणाऱ्यांक welcome to our program on health and it is entitled as Tumchi Bolaiki, Tumchea Hatant. Your health in your hands. And we have an expert in this domain and a research scholar who is acknowledged in more than 50 countries all over the world, and he recently retired as the head of the pathology department in the Goa Medical College. Welcome, Dr. Wiseman Pinto. My magacho yokar dotor tuka.
Happy to be here.
Amcho
Mr. Jovito.
o जावन आसा चवथो एपिसोड. In a third episode, Dr. Wiseman आमकां सायलेंट किलर हायपर टेन्शन म्हणटा ताजेर आमी नदर मारलेली आनी सायलेंट किलर हायपर टेन्शन ते नंबर्स मातशे वेगळे जाल्ले आसा आफ्टर द अमेरिकन हार्ट असोसिएशन केम आउट विथ अ न्यू प्रोटोकॉल in August 2025. तर हाय ब्लड प्रेशर जे आमी म्हणटा हायपर टेन्शन जे आमी जायते फावटी म्हणटा सायलेंट किलर दोतोर वायसमॅनान काल सांगला हार्ट अटॅक जावंक शकता तशेंच स्ट्रोक जावंक शकता आनी आयचो आमचो कार्य जातलो दोतोर वायसमॅन आमकां सांगतालो स्ट्रोक म्हणटा तें कितें ताजे सिम्पटम्स कितें आहा कितें करपाचें कित्याक stroke affects the brain and brain is for me is the number one vital organ. Is that correct?
Correct.
आमचे 6 vital organs आहा तितूंतले पयलो ते आमी म्हणटा is a brain.
सारकें.
आनीक ब्रेनाक तरी कितें जालें जाल्यार मनीस उरतलो ओ will be handicapped or कितें जातले तें कोणाचानू सांगूंक जायना.
Yeah.
Is that correct, Doctor?
Absolutely correct. Correct.
Yeah. So, brain म्हणटा तें कितें? Brain is a complex computer system.
Correct.
आनी all computer system कोणाकडेच करसूंक जावचें ना.
Correct.
तुका दिसता दोतोर आर्टिफिशियल इंटेलिजन्स all brain duplicate करूंक शकतलो ना
definitely not. ना.
आनीक human machine दोतोर do you agree it's a wonderful machine?
Absolutely. It is said, Mr. Jovito, the human brain is the excellent system in the whole universe.
Yes.
Because it is so complex and it has so many functions. And brain has got like cerebrum, which deals with higher functions, motor, intelligence, memory. Then there is cerebellum, which deals with coordination, movements. And then there is brain stem, which deals with respiratory center, cardiac center. So all these are very vital. All with your signals which come from your brain.
So brain sends the signal. And brain has signal to damage. Manis damage.
Exactly. So that is called stroke.
Yes.
So brain, Mr. Jovito, has got different parts and different diseases. The most important is stroke. CVA muntai, cerebrovascular accident. Now stroke, if you ask an artist, strokes it is painting.
Painting strokes.
Swimmer, if you ask, you're a sportsman. Swimming, you have breaststroke, you have got free stroke, backstroke. Different. To a doctor and to a patient, stroke is a very serious emergency, which should be taken very, very seriously.
But when we talk of stroke, we are talking about the human body's brain, which is a wonderful machine.
Right.
And this human body and the brain is the work of an intelligent and skillful designer.
Absolutely.
And this designer is God.
Absolutely.
Himself.
God.
It is God who has.
Exactly.
And man is God's masterpiece.
Correct.
Do you
fully agree?
There is a creator.
Yeah.
And that creator has created this beautiful body,
Correct.
and in this beautiful body, there is the number one vital organ that God has
Brain.
given, and that is the brain.
Brain, correct.
So we are a special creation of God,
God.
and God has designed the brain in such a way. It's not only movement. Movement, I mean, Sangila, no. Now your heart, your breathing.
Correct.
Does it also depend on brain?
On the brain, absolutely. The centers which are there.
Why?
Absolutely.
Why? And nerves are.
Nerves are. Spinal cord are. Nerves are.
And if we analyze our body, only the brain and the spinal cord is a case goshaha and adaha, and it is protected. If you are driving in your car, they seat belt also.
Helmet
because this brain damage, brain injuries can be fatal sometimes.
Correct.
So today we will talk about this complex and intricate masterpiece designed by God. And if you do not take proper care, and strokes normally burgyan zatai.
See, Mr. Jovito, stroke is called CVA, cerebrovascular accident. Cerebrum is the brain, and there are blood vessels. So if this blood vessel gets blocked, the blood supply to the brain is stopped. That is the oxygen, nutrition, and brain is one which is very important for oxygen and nutrition. If you stop it, the brain cells die, and brain cells cannot multiply, cannot regenerate. Brain, heart, these are two permanent cells, they do not regenerate. Whereas other organs, liver, kidney. Exactly. Yeah. So this is cerebrovascular accident. Now there are three mechanisms. There, the blood supply to the brain, there is a carotid, and it goes inside. There is a circle of Willis. One supplies anterior cerebral artery, middle cerebral artery, posterior cerebral. One of them, if it is blocked, that area where it supplies gets dead, loses the blood supply and will die if it is not.
So you are talking about the types of stroke.
The first one, Mr. Jovito, is called thrombosis. Thrombosis due to atherosclerosis. We have discussed it due to lipid block due to yellow fat, lipid, cholesterol, saturated fat. So that is called thrombosis. Second one is called embolism, which can take in younger age group. You just asked me, younger. I have seen patients who have got a heart problem, atrial fibrillation, thrombosis formed, and it goes to the brain, and that poor young person gets paralyzed lifelong. So that's called embolism, where the clot moves from one place to the other. So first is thrombosis formed there, atherosclerosis. Second is embolism, where this clot is gone from the heart to because of pathology like atrial fibrillation is gone to the brain and blocked, and poor person is paralyzed lifelong. 40 years, 50 years, I've seen patients, young patients.
That's why stroke is very dangerous.
It's very dangerous too. Third one is called hemorrhage. The third stroke is hemorrhage. Hemorrhage means one artery just breaks, ruptures. A pipe, if it ruptures, the blood goes outside. That is the most dangerous. Hemorrhage is the most dangerous. Different types of hemorrhages are. And this usually is because of hypertension.
High blood
pressure, which we are discussing, and we will be discussing.
The same thing, I'm tired.
Exactly.
It has to be measured.
Exactly.
Without measurement, tire blood vessel, brain
futolo, then blood spills out. And a pathology called aneurysm, common in the brain. Aneurysm in the arteries, amge soglio, borya hai. Third patient, third loka, one part of the artery gets dilated. What is that? Like bulb ko Boscoto. So that can also rupture, and that can also give rise to bleeding. Now I'll tell you. So this is the pathology, and then I'm going to tell you what is neurology in Goa, how it started, what is the system today. So I will be explaining all over the whole status of Goa.
But
So
this
is a pathology, 3 pathologies:
Yes.
thrombosis, embolism and hemorrhage.
okay.
Okay, 3 hai.
And most common
Most common thrombosis.
Thrombosis.
Most common.
So
And of which causes you a stroke,
Yeah.
and which causes part of the brain which supplies, so you get a paralysis.
So one side.
Hemiplegia.
Yes.
One side gets
One
paralyzed.
side. And we'll talk later.
We'll
on
talk about
recovery. and all that.
Recovery we'll talk later.
But
Alex,
stroke is very dangerous.
very dangerous, and is Mr. Jovito, very, very important to go to the hospital immediately when you get the stroke, because the first 1 hour or the first 3.5 hours, they say 4, but Teresa, I was talking with her, I'm going to talk about Teresa and all the other doctors, Dr. Teresa.
Yeah.
3.5 hours is the correct time. So you have to go to the doctor.
Yes.
The family has to take that person within 3.5 hours to the hospital, not doctor, hospital. Now, Dr. Teresa, I call her Teresa, she is my student, but Dr. Teresa tell me they should be taken to the district hospital and then GMC.
Dr. Wiseman,
Son.
I read somewhere that every minute a stroke goes untreated, every minute,
Yeah,
up to 2 million brain cells die.
exactly. Because you know the hypoxia of the brain
Yeah.
cannot talk for long time, few minutes.
Yeah.
So this is very, very crucial and critical. So now I'll tell you. Now you have the patient in the house, and he will tell you, I'm having a headache, I'm having weakness, I'm not feeling well, sometimes breathlessness, headache, palpitations, I can't move, numbness, vomiting. So these are some symptoms. Now you don't need a doctor. The patient is at home. Make him lie on the bed. He's lying on the bed, and there are some 5 or 6 tests. Anybody can do this test to see if there's a stroke, and then you have to immediately take the patient. There's 108. I'll come to.
So there are symptoms.
There are symptoms.
So you should not neglect
the
these
symptoms. And these symptoms are like, as I told you, giddiness, vision, blurring of vision, diplopia, headache, palpitations.
Suppose strong headache.
One side.
And together
vision.
देखपाचे सावडे शेता.
मागीर equilibrium भोंवपा जायना.
ओ एक हात
पांय
उंच येना.
Exactly.
So हे तुका warning येता.
Yeah, आता any person, whether you are educated, not educated, can do 5 tests करून जाते to sort of diagnose. First to patient sang smile. So when we smile, both our symmetrical. When there is paralysis, one side droops, एक side won't contract, droop, or close the eyes tight, one side cannot close.
So
eyes. Face. Smile. Smile. Second, tell that patient to raise his right hand on his own. Now the left hand, if it can't rise, means there's paralysis. But a paralyzed patient cannot take the hand on top.
Heaviness.
He cannot move.
Okay.
Then the left leg, first right hand,
so
then the left hand, lift the left leg, lift the right leg. So you know that there is a paralysis.
So, tu sagla face. Magi tu sagla arms. Magiri
legs. So with all this, you can know that this is a serious emergency. Now our government of India, government of Goa, has brought 108.
Yes.
Yeah. Credit to my health minister, Mr. Vishwajit Rane, who actually on his own did this. Why?
Yes.
He himself suffered. He has told me.
Okay.
He followed, which we were. So it has benefited the whole of Goa.
Yeah.
This 108 is there also in other states. But he brought it immediately at that time. Now, so it has benefited Goa. It is one of the best schemes that to gara duyan podlo, you phone and they atai. They are stationed in different places, so they will come. So if you are paralyzed, Don't wait. Immediately call 108 and they will take you.
आमगे जायत पार्टी गोंयकार की म्हणटा रातीचे आमगे
होय.
कोण
आणि
वयतलो
आणि एक सांगत तुका हांव.
होय
It's very critical. I was talking with Teresa and with Dr. Teresa and Dr. Bhatkar. हे दोग आमगे मुगे स्टुडंट दोगूय पूण they have done DM and they are doing very good job, which I am going to talk to you. They tell me that the patient should come to the hospital, either district hospital or GMC, within 3 hours. Results are very good because they have to
the
give
recovery
injection.
is
Recovery is very good.
Yes.
If they are delayed,
yeah
then there is permanent disability.
yes
Bad.
permanent
Lifelong. Magi sangot to come. I will tell you. So within 3.5 hours, 1 hour best. It's called golden period. So I told you 108. So they all stationed GMC, and then they will do your tests once you are admitted.
होय ते मागीर तुका
Doctor will look
experts
after.
take
Experts.
over.
I'll
Take
just
over.
tell you because let the people know also.
Why?
You do the blood test, you do ECG, you do echo, you do CT scan, MRI. It's important to know whether it is thrombosis, embolism, or hemorrhage, because the treatment is different. So mostly it is thrombosis most of the time. So they have to break that thrombus.
पण लोकांचे
Yeah.
आता जनरल
General.
लोकांचे so you look into the symptoms
Yeah.
तुम्ही म्हणा face
Face,
मागीर तुम्ही म्हणा
hand, eyes also you can. Hand,
जायत पार्टी they also say you speak
slurring.
slurring
Speech.
heavy
And one more thing I
Why?
skipped me. Ask the patient, Are, where you are now? What is the time?
Why?
They're disoriented.
Okay.
Or not. So all these, as you rightly said,
Yeah.
your angle
So
of the
you
mouth,
know,
eyes,
yeah,
left hand, right
yeah.
hand.
And तुम्ही सांगितला time.
Time.
Is
What is the
important.
time now? Yeah. No, you ask him where you are now. Where you are. They
Yeah.
get disoriented
Why?
if they are not okay.
Why?
That's very important.
Yeah.
So all these you put, and then very crucial rush to the.
Yeah. So time. They say very often in United States of America,
Yeah.
when they talk of this problem of stroke, they say time is brain.
Time is brain.
Time
Time is brain. And that's called golden 1 hour.
Yes. Now in that golden hour, 1 hour type, तुम्ही पढ सांगितला,
Right.
the ambulance
Yeah.
must reach within 10 minutes.
Yeah, yeah.
According to that.
सारखें.
Problem आमगे गोंयकार
होय.
ते accident देखून
होय,
जाले
होय.
त्या
ओगोत.
ambulance time hour सारखे पावना. But if it is a case of stroke, all the more time
Yeah,
is very
yeah.
important.
Very
So
important.
you have got F for your first thing that you talked about, the
Yeah.
face.
Yeah, face.
Then you talk about
Arms,
arms and
yeah.
the leg. Then
Legs.
you talk about
Speech,
speaking
yeah.
and time.
And time.
So
Yeah.
if you take the first letter of these 4 symptoms that you talk,
yeah.
it comes to fast.
Fast.
F-A-S-T.
Oh,
So it's
yeah.
easy to remember,
Yeah,
no?
yeah.
Dator?
Yeah. Very easy to remember.
Yeah.
Fast.
Yeah.
Yeah.
म्हणून रातचे समज आता 2 वरांचे
होय.
3 वरांचे
होय.
कित जाले सांगत तुका
होय.
हे आम्ही हाल सकाळी म्हणटाय
ना.
ते जायना.
जायना.
स्ट्रोकाचे तेन्नाच
Immediately, because every minute, as you said, is important every year.
Yeah.
And अनेक सांगत तुका, if you go to the GMC casualty, in one day, GMC gets 3 strokes, 3 patients. 3 who come with strokes. 3. So you can imagine.
Well, worldwide, stroke is number 2.
Number 2 killer.
Oh, number.
Right.
And in India, it's a 5th
Yeah.
or 6th.
You are right. Now, why world is different, you know.
Yeah.
We were talking
Why?
that America, I'll just, before saying anything, I'll tell you, I've done a lot of postmortem.
Yes.
About 20 years, I've done a postmortem of a patient, of a person who is 7-footer, Netherlands. His organs are huge. It's normal.
Why?
See, every organ is percentage of the body weight. So you can't compare with an Indian heart. His all organs, just giving an example.
Yes.
That's why their standards, it's percentage of their weight, their structure, etc. That we were saying, blood pressure, everything is depend on these things, weight of
Why?
the. So now coming back to our golden 3 patients.
Why?
In the West, yes, it has now little bit situation is better because there's awareness created. There are good medical facilities which are there, and in India, 2 things I'll tell you. The age is, we discussed first that the age of is increasing. that is the life expectancy.
Life expectancy.
77,
Yes.
80.
Yes.
So many are old people. Old people will have strokes.
Yes.
More chances.
And normally strokes after 60.
Yeah, after 60,
After
old,
60.
old. Now, Mr. Jovito, so these people, so in India, but now awareness has to be created. It is already created, and Dr. Teresa was telling me that many people now come on time. They know that you have to, when there's
It's a good sign.
yeah, but good sign,
Yeah.
because of awareness, because of facilities, and because of all these things. And these injections are given free of cost when you come to the hospital, to a Go Medical College and district hospital. Now, these injections are called urokinase, I am just telling you, or streptokinase. They are TPA, they are tissue plasminogen activator. What they do, they activate those plasminogen, forms plasmin that dissolves the clot.
The clot.
And it has to be first 1 hour
Yes,
when it is
yes,
soft.
yes.
Otherwise, it is gone
The
permanent.
damage is
permanent.
permanent.
So that is one. So many people come on time, but many people delay also.
But I am
delay.
I am surprised,
Yeah.
Dr. Wiseman,
Yeah, son.
that in your OPD sometimes you get 3 people
In the casualty, three per day.
per day.
Yeah,
So
you-
this is
you-
this is
yeah,
quite an
because
alarming situation.
alarming because our lifestyle is bad. Lifestyles are bad. We are going to come to the
Yes,
causes also.
yes,
Wait,
yes.
before the causes, so these are the 3 things. And then they do scan, CT scan, etc., Doppler, and
Now there are better facilities.
better
no?
facilities,
Good
but to diagnose it.
facilities, yes.
And then they give the injection. And
But-
but if you are sometimes delay is why.
Yeah. So Dr. Wiseman,
Son.
the crucial point is
Yeah.
taking the casualty.
Yeah.
The moment you feel the symptom,
Correct.
immediately shift to the hospital.
Immediately, 108.
Don't even call a doctor.
No, don't
Doctor
call
will-
doctor. 108 and go there.
Why?
Yeah.
Or if you have got a car,
Yeah.
you don't drive.
You don't exactly.
Yeah.
That patient should never drive. As I was just telling you, I have seen some patients.
Yeah.
They don't know they were driving and they had a stroke,
Oh my.
hemorrhage,
Yes.
very bad.
Yes.
So you should never drive.
Yeah. So ask somebody
Somebody to take you.
Take you.
Yeah, if the ambulance is delayed, ask somebody to take.
Yeah. Because
Follow-
sometimes ambulances
Exactly.
ego in India.
Yeah.
I would say
Population is high.
That okay.
Okay.
Many causes, but
Yeah.
all over the world
Yeah.
I have seen.
Yeah.
When I
Fast.
was in
Your football
Germany, when I was in Germany, there was
Yeah.
an accident.
Yeah.
The ambulance, and it was an air ambulance helicopter which came in 6 minutes time. And I happened to ask them,
Correct.
I said, why did you call a helicopter ambulance? Because it says we have done the initial assessment. We felt that it is a stroke. They say we cannot say it is a
Correct.
stroke.
Correct.
And we cannot shift the casualty in the village because
Correct.
in a village
Village.
where there are no facilities.
Exactly.
We have to shift the casualty to Hamburg.
Yeah. Which is far away.
Yeah, I was in Zoltau. I
I
was
see,
in
I
a
see.
village called
So
Zoltau.
very good, yeah.
And then it says, no, we have transported because unless you go to the hospital and if it is a case of stroke, a person, you never know whether he will survive.
You're absolutely right.
Yeah.
Absolutely.
So
right.
time
Time
is a factor.
Golden.
So you 10 minutes.
Yeah.
10 minutes under the golden hour,
Yeah,
it
yeah,
must
yeah.
come.
It must come, and
Yes.
you have
And
to
take the
take it,
Yeah.
and the doctors will do the needful.
Yes.
Immediately.
Yes.
That's streptokinase. Now, Dr. Teresa also tells me that there are also district hospitals which also. But sometimes CT scan doesn't work. No, I shouldn't say that because
Yeah.
I'm not in charge of district
Yes,
hospital.
yes.
But these problems are there. You followed. GMC cannot do without working CT scan or MRI. Though there have been occasions when you followed.
So ideally speaking, the best place would be to Goa Medical College
GMC.
Hospital.
But see, Mr. Jovito, if you use our common sense, a patient can't कौन सा आया था,
Oi.
or from Perne,
Oi.
or Tirakol,
Oi.
GMC Paul, better to go to Mapsa,
Yes.
or Margaon.
Yes.
So I'm giving you the practical.
No, you are right.
I'm right because see,
Dr. Wiseman, you are right.
Sorry. No, I'll tell you one more thing. So this is about the coming to GMC, etc. About doctors we'll talk later. So the results have been very good, but if it is not,
Oi.
then the disability is permanent. Permanent disability means hemiplegia. You need rehabilitation. You need speech therapy. You need physiotherapy, occupational, which all is there now today. There are colleges in GMC only. There is occupational health, physiotherapy, all colleges.
Well, you need rehabilitation.
You need lot. And then Zalona, if he's an old person, he's paralyzed, you need lifelong one sort of a caretaker or nurse.
Yes.
I went to the nursing college that day, and that, you know, everybody, there are old people. Families are are abroad or out of Goa.
Yes.
You know, for jobs they have to
Children
go.
are not
there. So alone. So we have to keep somebody, lot of cost, etc. And the nurses, they are actually like home nurses. They are trained to see all this.
Home nursing.
Yeah, I was in the nursing college talking to one of the senior nurses. She's saying, doctor, they should not be called nurses. They should be called assistant to the nurses. I said, you are right.
Home nurse.
Home nursing care.
Yes.
You know, now our government wants to, which is good, that, you know, more and more schools to train these people. You need more and more. Otherwise, you know, about 10 years back, they used to bring from Kerala.
Yes. We used to do that.
Now there are already, like, you know, what do you call that, agencies in South Goa, North Goa.
And they are making big money.
Big money. It is very lucrative because, you know, they charge lot of money and you have to, so this is
so you need an attendant.
So if the patient, you know, So this is one thing about the strokes, etc.
Sometimes, doctor, I came across, in case of my one relative, went to doctor, and for that moment could not remember things immediate or the past or something, and the doctor said transient.
Exactly, TIA. Transient ischemic attack.
So what is that?
Yeah. Now see, sometimes what happens now? This is a thrombus, or it is an embolus. It's a stroke. Sometimes what does this thrombus contain? It contains, you know, your fat, as we saw, cholesterol, triglycerides, fat, atherosclerosis, and platelets. Platelets are blood cells. Sometimes what happens, the platelets, you know, go and form small plugs and block it, and which is transient. So when they block one place, one artery, then for a short time he loses his memory, and then he recovers after treatment. So those are due to it's transient, which lasts for few minutes.
Only for that short
time.
Very
so
short
it is
time.
due to the platelet plugs which block. So that, as you rightly said. Now, Mr. Jovito, still there are other patients. This is acute stroke. There are some patients who get chronic stroke. Like the chronic stroke means they will have some mild headache. They will not remember. It's on a chronic basis. So they have to go to the doctor.
But there is treatment.
Yes, there is treatment. Now, so this is the thing. Now, I want to also tell you, hemorrhage is a very dangerous thing. Hemorrhage means rupture,
rupture of the blood vessels.
Now, we have some procedures, and Dr. Bhatkar, Dr. Sanat is also our student, my student, and Dr. Teresa also. They have done MBBS here, MD in medicine. Both have done DM, with super specialization of neurology, in PGI Chandigarh, which is number 2 in India. AIMS is number 1, but in post graduation, PGI may be better in some. So they have trained there, and they are doing very good work. Now Teresa is much dedicated. Her auntie was also Dr. Adeli Acosta.
She was the first neurologist in Portugal.
Portuguese colonies. She came to.
She was the first. And she was living here in Alting.
Right.
I remember.
Right. And she was appointed as the medical superintendent in 1958 of our psychiatry, which was named after Abbe Fari. Followed the well-known Indian
from
Goan.
From
Kandoli. Right. So, and in fact, the family has instituted a scholarship, a prize, a gold medal for psychiatry, who comes first in her name. When I was the dean of the Goa University. So I think the first candidate who got is known to me is, of course, my student, Dr. Colin Braganza. So he got this first prize, the first award. Because during COVID, the things were online, etc. So now he got. Anyway, so this is about Teresa. Now this Bhatkar, Sanat Bhatkar is also my student, also done MBBS. Both are very brilliant students. I have been examiner for them, so I know that they are very brilliant students. Sanat also went to Pune after coming and did this training in called interventional radiology. This interventional radiology is a new branch. So what they do, they put a catheter and they embolize or cauterize,
Yes.
or put some clips if to prevent hemorrhage.
Okay.
Yeah, so which is very, very crucial. If there is an aneurysm, they have to clip it. It's very costly, and Sanat has done many such cases. And second, or they can put some, if there is a AV malformation, they put some material called onyx, which I was fortunate to see on histopathology. I saw it first time, and I asked my students, poor people I had never seen, and I am also seeing first time. It was not written, as it is AV malformation. I said this has to be onyx. Open the net and your same picture is there. And I showed this this picture to Sanat, because he has not seen microscopically, he is only doing it. And there is a cousin of mine, Dr. Keith Pimen Pereira, who is an interventional radiologist in Missouri, associate professor, United States.
Yeah.
She is also doing this. I showed him at the airport, Delhi airport. He was going somewhere and we were going somewhere. So they were happy to see it. So this is, now why this is important, before these guys came here, before this fellow, Sanat, Dr. Sanat came, patients had to go to Bombay or Belgaum or to Bangalore or to Delhi, and there is a famous Goan by name Dr. Karapurkar, Anil Karapurkar in Bombay. He's Goan but born and brought up and in Bombay. So he was doing this, neurosurgeon. Dr. Jindal we used to send patients there. But now you don't have to go to.
So now you have all this
All this here, and Sanat has done hundreds of.
And our own.
And 20 of the other one where onyx is put.
Yeah.
And the government gives free of cost. Each patient, those coils are very costly, because there are different chemicals. They have to be seen under X-ray and all this. So Sanat, I myself have seen under microscope, under slide.
Yes.
For the first, I show it all over India. Most of the people have not seen it. So anyway, there are interventional radiologists who are another one, Dr. Pawan.
But I am very happy that
you
have all these facilities
in Goa,
and done by our
own people. Yeah, one Dr. Pawan, he trained in All India Institute Medical Science. He also came. He was doing of the other organ, brain. Now this guy is, because he's a neurosurgeon, it's not easy. Sometimes the thrombus can go and cause problem in the other areas. When you do this, it's not simple. You have very delicate, sensitive, expert. So
unless you are a super expert.
This. Yeah, and neurosurgeon is a neurologist. So Pawan does of other organs also, and now so that's a good thing for Goa.
Yes.
Plus, so these are the neurologists. There are other neurologists like one Dr. Parul Dubey. She is in Manipal. Some others are there in South Goa. The Panandikar, he is also. They are all DM. So we have a good
technically
network,
qualified people,
DM, and they have been given lot of facilities of these. Otherwise, before that, Mr. Jovito, just as the history, after our Dr. Adelia, then there was one Dr. Kenkere, R.B. Kenkere, then there was also Dr. Manuel Dias. But theirs was, they've also, Dr. Manuel Dias, famous family near the post office of Dr. Vitor Manuel Dias, trained in Germany, and Kenkere also trained in Bombay. And after that, Dr. Shiko Vaz came. Dr. Shikot. Yeah. You call him Shikot, but his name is Shiko. Dr. Shiko Vaz was brought by Dr. Wilfred D'Souza. Why? Because they wanted to do MCH in neurosurgery, Dr. Jindal, MCH in neurosurgery, super specialty. That's the first course started in Goa Medical College, super specialty. So they had inspection, it failed, so they needed a neurologist. So he, being a Goan, he's trained in Leeds, and so he was in JJ, Grant Medical College, as a professor, and Nanavati also he was, I know that. So he came to Goa, but he was not doing these procedures. He was a, these procedures are now started by Dr. Sanat Bhatkar. Full credit.
So that means this full procedure.
Full procedure, yeah.
And this is most modern.
Most modern and free of cost. That is also important.
Yes.
It's lakhs of rupees.
So
Before I forget,
yeah.
there is still one more. There was one Aaron D'Souza also. He also was neuro. And not forgetting Dr. Suzette Menezes. I don't know, Professor
Yes,
Suzette. She
yes,
was my professor.
yes.
Her son. She had two sons. Just I'm diverting.
Yes.
Krishe is also done DM. He is now in USA
Okay.
doing specialization in Parkinsonism.
Yeah.
I brought him to Goa. He gave a talk.
She is the wife of Judge
Tito Menezes. And now their son,
Okay.
Justice Valmiki,
Yeah.
is a judge.
Yeah.
And I've seen very good,
Yeah.
happy to see.
Yeah.
I know the whole family.
Yes,
She is
yes,
my teacher.
yeah.
Happy to see the Justice
Dr. Suzette was in pathology.
pathology. When I joined,
Yeah.
she was a professor
She was
and
there
head. She
already.
is
my neighbor.
your neighbor and my
Yeah.
guide. So anyway, she passed away. But these two sons,
Yes.
they have done very well.
Yes.
One neurologist, one is like the father.
So
I've given you the whole background of neurology.
To summarize to some extent, if you have the symptoms that we talked about, strong headaches. Now, people dismiss headaches.
Correct.
And if you have problems in raising your arms, legs,
Correct,
mobility, and then your speech, and then you
you
have
can't walk properly or-
Yes, and a little bit of haziness.
Dizziness.
You should go either to the district hospital if
Correct.
you are far away,
Yeah.
or if it is close by, go
GMC.
to the Goa Medical College.
Absolutely, correct.
And they will take appropriate care. And is it true that they say that 80% of all strokes are preventable?
Yes. Now we will come to prevention.
Yes.
Now, why these Western countries, it has been better situation. We have to prevent strokes. Prevention is better than cure. So
now they say prevention is the cure.
The cure. It's called preventive medicine.
Yes.
Personalized medicine. Yesterday we were discussing preventive medicine, genetic medicine. So now coming to prevention. So what are the risk factors, Mr. Jovito? They are the same for all these diseases.
And this is important.
Very, very important.
For all our, especially Goans.
For everybody
Yes.
of all ages, Goans who are living in Goa, who have come here, it is important for everybody, all ages. And what are they? They are all risk factors. Risk factors are first is hypertension.
High blood pressure.
High blood pressure. We discussed yesterday.
You talked about it
Yeah.
extensively.
Extensively.
And exhaustively also.
Yeah. And we had gone to that for all this hypertension yesterday. Second is diabetes, which we are going to talk
This is
now.
very common.
Which is very common and we are going to talk.
Yes.
Diabetes.
We will take
Then
it up in the next episode.
Your diet has been, it is very unhealthy diet. So for healthy diet, vegetables, fruits, lot of water, tea, coffee, green tea, coffee, no sugar, less sugar, no salt, less salt. So these are beneficial. Then lot of legumes, dal, lentils, eggs, and fish, omega-3 fatty acids, small fish.
Small fish is better than big
better
fish.
than big fish. Mackerels,
Yes.
talle, bangde.
Yeah,
Talle. Then because they have, as you said, omega-3 fatty acids. Now I'll just come to some more points. In addition, good sleep, decent sleep, deep sleep of 7 to 8 hours per day. Exercise. Sedentary is not good. Exercise. Then in addition to doing your exercise, stress. Stress is another very important killer. Stress. As I told you.
They say stress is a common factor for all the problems.
For all the problems. Now, Mr. Jovito, so these, and they say Mediterranean diet is the best.
Yes.
Olive oil, olives, green leafy vegetables, fruits, and, all these different colors.
Yeah.
Now, a new study has been done where they say that your oral hygiene is very, very important for all these diseases. All
oral hygiene.
Oral hygiene. I'm coming. Oral hygiene means your teeth, gum. You have to brush them with for at least 2 minutes.
Yes.
Morning and night. I would recommend 3 times a day.
Okay.
After breakfast, after your lunch, and after your dinner.
Yes.
Which I do.
Yes.
So
You have beautiful teeth.
so Mr. Jovito, brush them for at least 2 minutes, because the bacteria plaques form and they go through the blood and can cause hypertension, can cause diabetes, can cause
Heart
attack, can cause stroke. So because they cause inflammation, and inflammation weakens the arteries, the walls of the arteries, veins, blood vessels. So this is a new concept which has to be, though we didn't talk about it that day, we have to retaliate or stress that oral hygiene is very, even cancer, head neck cancer, oral hygiene.
Oral hygiene is important.
Yeah, you have to.
And the dentists now, they talk about flossing also.
Flossing.
At least once a day.
You are right.
Yeah.
And they say that fluoride toothpaste is better. I am not going in those details.
No. But what is important is oral hygiene.
Oral hygiene,
dental,
brushing your teeth.
2
times at least, if not 3.
Yeah.
So these are some of the important factors that will help our people.
So we have discussed the lifestyle. Yes.
Now see, in the lifestyle, Mr. Jovito, I was discussing beautiful places of Goa. Goa is a very beautiful place, like the human brain created by God. And I told you some areas. Every time I think I should tell you some more. Tirakol is also, the fort is very beautiful.
Very beautiful.
Now, made by the government of India and government of Goa, a walkway along promenade, along the river. It's like a foreign country. We go for a walk there. That is, from GMC, old GMC. That is a fish market which is there. You go through that. It crosses the children's park. It was called. We used to walk that side as in 7th standard to Miramar. That is made into a promenade, a walkway. Lot of people walk there. It's very beautiful. Very, very beautiful.
So when you talk of exercise.
Yeah, and not only exercise plus seeing, beautiful things, environment, green, your mind gets
So you get de-stressed.
De-stressed. Yeah. Besides meditation, praying, and all. So this is 2 places. Now coming to South Goa, I already told you, Galgi Bagh. This is a beautiful beach, which is called as Agonda Beach.
Agonda.
It was ranked in the Asia's top. Now, my speaker who came from Italy was searching that after my conference, he'll stay a few days. From Italy, he's an old man. So he only found out Agonda and stayed there. He phoned me from there. He said, Dr. Rock, this is the place of my dreams, and I have not been to Agonda. So after that, I went to see. It's really beautiful.
Yeah. So you de-stress.
I de-stress. You de-stress.
And
de-stress not only even by seeing nature. Asolna is a very beautiful with the river Sal, Kavilusi. I told you Mobor.
Yes.
All these Betul.
Yes.
There's on Baradi on top. There's a cross.
Yes.
Beautiful. I told Kabdaram.
Yeah.
When I went to Kabdaram, I went at 12 o'clock. My mother was a teacher there. Her first job. There must have been no buses that. I was wondering how she reached there. So now it is well connected.
So these are the natural methods of de-stress.
Of de-stress. Kabdaram looks like Greek islands. As beautiful as that. It's not, I'm not trying to.
I know.
This is Goa.
Yeah.
So Goa should not be spoiled.
Yes.
And so this is de-stress. Yeah. Of course, you can do your, meditation. You can do praying, yoga. All this you can also de-stress. These are other ways.
Yes.
For me, de-stress, I go and close my eyes as if I'm sleeping.
But it's important.
It's very important.
It's important. And also, I think we need to talk about smoking and drinking.
That is without saying. You should not smoke or pan. Pan is,
pan also.
Pan, smoking, drinking, narcotics, obesity.
Yes. But in Goa, everybody is accustomed to chota pig or large pig or whatever it is.
Yeah, as we discussed yesterday.
Yes. But smoking and drinking is absolutely not indicated.
Not required. It has to be. And drugs, of course, very narcotic drugs. No.
Yes.
Red wine, I told you.
Yeah, we talked about red wine.
Yes. So these are some of the very good things, and I'm happy that whatever government of Goa 108 is very good, because otherwise you can imagine
I know.
such one car, such
Yes,
somebody
yes,
followed
yes.
too. And but it's there in other states also, because the government of India, development takes place, structural.
So we are coming almost to the end of our presentation, Dr. Wiseman. What's important is for the people in general to remember the risk factors.
Risk factor and prevent.
You talked about
Yeah.
high blood pressure.
Yeah.
You talked about diabetes.
Correct.
You talked about fatty deposits
Correct.
of atherosclerosis.
Correct.
You talked about smoking, heavy drinking,
Yeah.
and we also need to talk about blood thinners. Now, a
Yeah.
lot of people are
Yeah.
using this blood thinners.
Yeah. Now see, according to me, all these blood thinners, plasminogen, TPA, when they are given, they should be done with proper medical supervision.
Yes.
There are some tests, PT-INR and others,
Yes.
which will monitor this. Otherwise, they can cause harm.
Yes.
Like if there is hemorrhage, they can cause hemorrhage. So these are the things that they should be done by a specialist.
Yes. So they can all increase, if you don't take proper care in this
Yeah.
risk factor,
Yeah.
they can always increase the risk of stroke.
Correct.
And stroke leads to brain damage.
Yeah.
There is no doubt
No
about
doubt.
it.
Yeah.
Then disability
Yeah.
and often death.
Yeah.
And after suffering one stroke, you take proper treatment. Are there any chances of recurring the second stroke?
You can get it called progressive stroke. Progressive. Even heart attack can get progressive MI. Stroke also you can get progressive. Now, I would like to add just two before we end.
Yes.
During COVID, Dr. Teresa Noronha Ferreira, Dr. Noel Menezes and myself, there were two young girls who were given vaccine for COVID, and they developed thrombosis. Young
Is it?
girls,
Is it?
20s.
Is it?
Yeah, and Teresa and I, we had read literature, and we diagnosed them, and we treated them, and today they are alive because of our knowledge.
Yeah,
And
but,
it's called VITT, vaccine induced thrombotic thrombocytopenia.
Okay.
Noel was taking exam, I was the dean, so I had power of the university to go and tell him, just see these patients, do their tests again, all this during COVID.
Is it?
And we diagnosed it.
Yeah.
And Teresa asked me, telephoned me, and we diagnosed it, and they were saved. Healthy girls too, after the vaccine, they got, this is a known complication. In literature it has come now, but we had diagnosed before it came in literature from journal. So they were treated, and now what happens, they have to take anti-epileptic because of lifelong
So there is some disability.
disability. Yeah.
Okay.
But they were saved.
They survived.
They survived.
They survived
Yeah.
with the prompt intervention.
With a prompt intervention. That's why I want to talk about
Yes.
Dr. Noel.
Yes,
There is
yes.
sincerity which is there.
Yeah,
And-
it's important. It's
Yeah.
important.
It's not only intelligence.
Yeah.
It's a human sincerity.
Yes.
You go out of the way to help.
Yeah.
That is the thing.
So, Dr. Wiseman, thank you very much for sharing with us the symptoms of stroke and seeking emergency care immediately. And I hope all our viewers will be wiser enough through Dr. Wiseman. Pinto.
Thank you, Mr. Jovito. Muito obrigado. आणि देव बरें करूं.
देव बरें करून तुका दोतोर. हें आमी परत सांगता हे लोकांक थोडें आयकलें आनी हेजेर उपाय घेतले जाल्यार our aim and CCR TV's aim is to save a life and prolong good health. देव बरें करूं.
Thank you.